This is a really important conversation for you to understand if you're considering adjuvant treatments after breast cancer surgery. So even after some patients have their cancer removed surgically, they're still put on medications to decrease their chance of recurrence. And this is statistics, so it's boring, but it's really important that you understand this so you can make an informed decision. Let's say a given medication decreases your chance of recurrence of breast cancer from 3% to 2%. That's an absolute reduction of 1%. Your risk was already pretty low to begin with, right? 3%, but it did drop it to 2%. That could also be presented as a relative risk change of 33%. That sounds crazy, right? A 33% reduction? Who wouldn't want to go on that medication? Why this matters is that some of these medications have pretty serious side effects, and a lot of women can't tolerate it. So women will come into my clinic, and they'll say, look, I'm really having a hard time with tamoxifen or Verzenio. Do you think I should come off of it? And so this is the conversation that I have as a plastic surgeon who understands statistics. I really present that to them and say, look, you have to understand what your true risk reduction is and whether or not it's worth it to you. So you need to think in the future and think, if I go off of this medication and make the active decision to stop taking it, am I going to be at peace with the fact that I made that decision if I have a recurrence? On the flip side, there was still a 2% chance that you recurred even with the medication, right? So some people still recurred on that medication. So am I also going to be at peace staying on these medications, knowing that I did everything I could if I have a recurrence? Hindsight's 20/20, right? It's impossible to know how you are going to feel in either one of those disastrous scenarios. But that's really an important mind exercise that I like my patients to go through. I would love to hear from you if you had an adjuvant treatment, if you really understood what your reduction was in recurrence, and whether or not you had conversations with your healthcare team about that.